So happy first Friday of September. We're
Hey.
launching a Labor Day weekend, and I get to be here with Dr. Danielle Bailey, my dear friend, who I'm going to call you my dear friend, even though we have never hugged or been in the same room.
Yes.
But I feel like you are a dear friend.
Yes. Yes. I feel the same, the exact same.
Yeah. So welcome, Danielle. I'm just going to give a little background on how we met. We are here tonight to talk about functional medicine in general and how that connects with healthy aging. So September is Healthy Aging Month. And Danielle and I met in our functional medicine training. So getting close to 2 years ago now.
Yeah.
We started.
Yeah.
Yes. So we did lots of Zoom calls, and she was a generous and gracious colleague and teammate in that process of learning. And I'll share how we first connected. So part of what we did as in our training was to learn how to launch a business. And part of launching a business was learning how to be on camera. And I was completely terrified of it. And I really didn't want to make my first video. So I begged, would anyone just send me their video? And Danielle was like, sure, send. And you were like a movie star. Like, how did you do that so easily? So you gave me confidence. Okay, I can do this. But now I'm reading your bio, which I did not know because you're so modest, that you represented Nevada in Miss Black USA pageant in 2012. So you're used to being in front of lots of people. You didn't tell me that before.
No, I didn't.
No, but I'm not surprised at all. I did see a little video of you singing at your wedding, and you have an amazing voice. So I'm sure that was your talent.
Yes, it was. Thank you. Yes. I love
Yes.
to sing. Yes.
But you've got it all. So you got brains and beauty as well. I'm going to read a little bit of your bio and then we'll chat.
All right.
Okay. So Dr. Danielle Bailey, raised in Illinois, near the Chicago area, right? Mm-hmm. Has 11 years of clinical experience as a physical therapist. And the last 6 years, she's been in the Dallas-Fort Worth area. And that's where I went to grad school. So at some point, I'm going to get down there and see you and all my classmates that are still down there. In 2010, she received her doctorate of physical therapy from Washington University in St. Louis. And in the last 4 years, developed an interest and expertise in women's health, and now provides therapy services for individuals experiencing urinary and fecal incontinence, constipation, pelvic pain, sexual dysfunction, and for women during their pregnancy and postpartum. Now, those are sometimes uncomfortable things to talk about. Yeah. But we all need an expert in those areas when we're having issues. So thank you for being you and helping women. Not only does she provide women health services, but she is, as I mentioned, a functional medicine practitioner. So focuses on getting to treating the root cause of chronic illness. So she's a mother of 3. And you actually went through that functional medicine training with a baby in your belly. They extended the class for you a little bit so you could come back in after that little baby was born. So you are back at work and in your private practice called 360 Health and Wellness Services. Your mission is to provide unparalleled healthcare to every patient you encounter. And I believe that is true and that you do that. Whether it's through telehealth services, in-office visits, or home visits, Danielle's desire is to always inspire and positively impact the lives of everyone she encounters as a physical therapist and functional medicine practitioner. And I can vouch for her that she does that with every interaction, whether you are her client or her friend or colleague. So welcome, Danielle.
Thank you so much for such a kind and warm introduction. I truly appreciate it. Yes, I'm so glad we crossed paths in each other's lives because it's been a blessing to know you. So
it's been a blessing right back.
Yeah.
So tell us a little bit about how you got into functional medicine, what drove you down that path, and then we'll talk about, what functional medicine is.
Yeah. So I first became aware of functional medicine with my own health issues. About 3 years ago, 4 years ago, I had been having chronic issues with my gut health since I was a child. I had tonsillitis, and my mom would always take me to the doctor, and they would always give me antibiotics just all the time. They said I had strep. But until she was talking to a coworker, the coworker said, "Hey, she may have tonsillitis. Take her to her ear, nose, and throat doctor." And that changed everything. So I ended up having my tonsils removed, and that solved the issue of this chronic strep throat that I always had. So because of this strep throat that was treated for a few years and taking antibiotics, it affected my gut health as a child and even into my adult life. I dealt with a lot of issues, got a lot of infections, didn't know why, until my primary care physician in my adult life just a few years ago said, "Hey, why don't you go seek a holistic doctor?" And so I just Googled holistic women's health doctor. And I came across a chiropractor. And when I went to her office, the care I got was so different. She really talked with me in depth about what was going on, the symptoms I was having. And she said, "Hey, I want to run a few tests on you and see what's going on." And I didn't even know it was called functional medicine back then. But that's what she did. So she ran these tests, came back, and she told me what was going on and why I was experiencing these issues, the root cause of those issues that were so, debilitating for so long. And she got me on these supplements and diet recommendations and encouraged me on different lifestyle changes that I could implement. And it was after that experience, I felt completely different. I haven't had to go back to the doctor for these chronic infections I was always getting. I was like, man, this is super cool. I wish I could do something like this. And I didn't even know I could do something like that back then until, I was exposed to the functional medicine training that I was presented with, where you and I met, and found out that as a physical therapist, I can actually incorporate that in my own practice. So I was like, oh yeah, I'm totally doing this. I can help people. And that's really what got me into becoming a functional medicine practitioner.
Yeah, awesome. It's funny, we've never shared our background, how we got into it. So that was, I had similar, lots of strep infections and lots of tonsillitis and lots of antibiotics as a child. So I can completely relate. And also when I got treated by a holistic practitioner, I also had no idea it was called functional medicine. And I also didn't know I could do it. And when I also found out that as an occupational therapist, I could do it, it was like, oh yeah, this is the road that I'm taking. Yeah.
Yes.
So similar paths. Yeah.
Yeah.
Once you experience the power personally, it's like, oh, I have to share this with others.
Yes.
Because you walk blind and frustrated for so long. And then it's like, oh, there is another way.
Yeah. Yeah. Absolutely. Absolutely. Yeah.
So if you were going to explain what is functional medicine to someone who's never heard of it, what would you say? How would you share it?
Yeah. So I always tell my patients that, or anyone, functional medicine is an area of medicine where we look to discover the root cause of someone's health issue. And through looking at a holistic picture, including diet, your environment, your lifestyle, that allows us to really hone in on what's really causing you to experience certain issues. So through specialized testing, one can begin to understand the why to the what. And that's how I share with patients. I keep saying patients, but that's how I share with anybody what functional medicine is and how it really helps someone to be able to really experience optimal wellness in their life if that's what they're looking for.
Right. So if you were going to label the what maybe for you was stomach issues, the what that finally sent me to the doctor was neck pain. But then you go back way upstream and look at the ask why over and over, you come up with all these different reasons. And then you can get to the root cause of it instead of, for me, just being in pain or, I had lots of pain issues. I had gut issues and neck pain and all kinds of pain. So it's either be in pain or take painkillers or figure out why you're in pain.
Yeah.
Read that.
Yeah.
Yeah.
Absolutely. Yeah.
So asking why. Okay.
Yeah.
Awesome. So what makes functional medicine different than conventional medicine? And I'm happy to know that your primary care physician actually referred you to a holistic practitioner.
Yeah.
So how are they different?
Yeah. So when I came into my doctor, I liked her because she's very approachable, and she would treat my symptoms. I came in, if I had an infection, I was given an antibiotic to take it for 5 days or 7 days, and you should feel better. And that kept happening over and over and over again. And finally, she's like, and she knew that I was really into essential oils. So one of the things that she said was, hey, why don't you look up a holistic doctor? She didn't even really have a reference, but she knew they were out there. And she knew that what she was able to offer me was simply the medication to help the symptoms that I was experiencing. And the medication did help, but because I was coming back, it wasn't solving the issue. So the biggest difference between a conventional doctor and a functional medicine practitioner is that a conventional doctor will treat the symptoms. They understand different types of conditions and diseases that one might be experiencing, and they're able to prescribe you medication, give you the right dosaging, and tell you what to take, and it'll help with those symptoms for the most part. I mean, we hope that they help with the symptoms, but in terms of taking time to look at your diet, your lifestyle, your environment, those types of things, a doctor really doesn't do that in your typical office visit. It's typically 15 minutes or less. You're in and out, and that's pretty much it. And so because you don't really have that time to dig deep and to find the why, you're kind of in this vicious cycle trying to solve these health issues that become chronic. And so with functional medicine, you're able to really take the time. You're not going to feel rushed working with a functional medicine practitioner because they're going to look at your environment, look at your sleep quality. What are you eating? What are you exposed to? Are you in a home that may have mold exposure? Things of that nature that you don't really get asked with a conventional doctor. So that's really the difference. We look at the whole system. Not that physicians don't understand the whole system. They go to med school and they know the whole body system. But as a functional medicine practitioner, you really do take the time to look at all these organ systems, see how they're connected, and put the pieces of the puzzle together to help someone find the root cause of their health issue.
Right. Thank you. Good explanation. And there were several conventional doctors in our program who were, frustrated that they only could spend 15 minutes with their clients, with their patients, frustrated that they were only able to diagnose and prescribe and not get to the root cause. Functional medicine initially did start out with physicians, but has expanded. So I don't have doctor behind or in front of my name. And, but I'm acting more as a health coach and all my skills as an occupational therapist to create what I call, or what my professors call, the just right challenge. So, if somebody's eating burgers and fries every day, I'm not going to say starting tomorrow, you need to get rid of all of that and have a salad for lunch and dinner.
Yeah.
So we would ease into it nice and slow. And so it takes time. And, sometimes weeks or months or longer. of hand holding to move in a different direction down a healthy path.
Absolutely.
So we talked about the why versus what. I don't know. Do you have an example of that when somebody comes in with a what and you go look at the why?
Yeah.
I mean, even from a physical therapy perspective.
Sure.
Just to help
Absolutely.
that.
Yeah. So typically when a patient might come in, I do specialize in pelvic health, but I do have orthopedic patients that come in. Orthopedic meaning they may come in for knee pain, shoulder pain, hip pain, back pain, something of that nature. And they come in and their diagnosis could be, evaluate and treat for knee pain. The patient has arthritis. So they come in and I can give them exercises. I can teach them on postural awareness. I can teach them how to appropriately sit, stand, walk, use different types of shoes. Maybe they're not using the right type of shoe that's fitting for them, that's affecting their knee. We can give stretches and all that. And they can get better. They'll feel better with, what we do in physical therapy. However, more than likely, it won't be, I would say, 100% gone. They'll have maybe 6 months later come back to see me for the same issue. But when I look at the why to their arthritis, which is this inflammation in someone's joint, we can ask ourselves the question, what's causing this to happen? So looking at diet, are they eating foods that might be causing some inflammation? That could be the reason why they're having this arthritic flare-up, and that's causing the knee pain. So even though the exercise is important and I can, look at posture and all those things and they can get better, a patient will really begin to experience true relief when I look at what's causing this inflammation or what's triggering more of this inflammation. And it could be a diet, environment, and things like that. It could be a hormonal imbalance. And so that's an example of what I would see in the clinic. And I'll give an example of pelvic health. I see a lot of patients that deal with urinary leakage or may have overactive bladder syndrome. And with that, I may ask myself the question, what could be going on hormonally that's causing them to have these issues with their pelvic floor? Yes, there's weakness going on as we age. Estrogen decreases and that affects the tone and muscles of the pelvic floor. And so looking at that, even though we all age and we all may have a decrease in our hormones, there may be things that we could do diet-wise, supplement-wise that can help with supporting someone's hormones as they age. So by supporting one's hormones, we can see a better improvement in their issues with the pelvic floor versus just giving them the exercises for the pelvic floor. Right. So that's an example of, what I would see with a pelvic health patient, and then what I could see with an orthopedic patient that comes in for like knee pain or back pain or something like that.
Yeah. Does stress relate to hormones?
Absolutely. It's a huge factor.
We haven't talked about stress yet.
No, we haven't. And I think if people would understand how much it affects so many things, I think sometimes we just kind of brush it off our shoulders and like, oh, everyone's stressed, but really taking the time to address the stress and being intentional on this self-care and self-love really can make a difference in inflammation, everything. So stress is a huge factor. Yeah.
Yeah. I've seen that directly personally and with clients. I teach yoga on at least weekly basis, and know that for me, that is what has gotten me through stressful times, and surprised, maybe not surprised, but interested in how stress can really impact the hormones and how that then it impacts your sleep and this whole cycle. If you're not sleeping well, then that's impacting your stress hormones. And then if your stress hormones, your cortisol levels are high, then you're not sleeping well. So
Yeah.
Cycle, just bring it all down, bring it all down.
Yeah.
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 I have a personal story that connects to the what and why orthopedic story. I was getting physical therapy for hip pain, probably have a labral tear. And the dry needling and the ultrasound and the exercises 3 days a week, I felt dramatically better. And we dropped it to 2 days a week and I was still feeling okay. And then we tried 1 day a week and nope, pain came back. We did that at the same time. We were going through the functional medicine training, and the physical therapist was wonderful. She'd worked all her magic, but she said, I really think you have a tear. I have the name of a great surgeon if you want to go check it out. So I was not looking forward to the possibility of surgery. At the same time, I was going through an elimination diet. I was already off of gluten and dairy, but I knew I should also go off of sugar. So I did. And guess what? That hip pain went away. And that's been almost 2 years ago.
Wow.
And if sugar gets back into my life, which it does on occasion, not too many days later, the hip will flare up again. And then I take sugar out again, as I know I should, and the hip pain is gone. So just a dramatic and direct reminder to myself that food plays such an impactful role in inflammation in your body, and inflammation plays a role in everything.
Yeah. Yeah.
In pain, autoimmune flare-ups, and in cardiovascular disease and diabetes, inflammation. So we're kind of one of our main focal areas is to bring down inflammation, to investigate it. What are your numbers? How do they look? And how can we bring them down?
Absolutely. Oh, I did not know that about you.
We're learning all kinds of things about it. So there's lots of areas of functional medicine, but you did a really nice webinar to kind of highlighted 5 areas, and they relate kind of broadly to health, but since we're focusing on healthy aging, they're going to also relate to healthy aging. So this is kind of, we're asking the why is this going on? And the first area that you address, what would that be?
So that was
in with issues.
Yeah. So the first place that I like to start is with gut health. Everything starts with the gut. You hear the term, the phrase, food is our medicine, and it truly, truly is. And it's very important for all of us to understand that everything starts with the gut. I mean, our hormones are affected because of what happens in our gut. There's a gut-brain connection that affects our stress and how we feel. So gut health is the very first thing that I start with, because it's important to know what foods you should and should not eat, what foods may be causing inflammation, what foods are not agreeable with your system that you've been feeding yourself for all these years that are actually wreaking havoc in your system. And so it's important to start with the gut. I love starting with a gut test because it answers so many questions. What are those bacteria levels? How can we optimize them and make them at appropriate levels that is healthy for your gut environment? Are there any inflammatory markers inside your GI system that are causing issues? So very, very informative, because it gives us a baseline for where we are and where we need to go by firstly starting at the gut. So that's the very first thing that I believe strongly is one of the whys to, why someone might be experiencing some health issues.
So what does a gut test look like? Is it invasive, or what do people have to do to get their gut checked?
So I'll be honest, most people don't like to do it. But when I tell them what it'll answer for us, they're like, okay, I'll do it. So typically you will collect stool. So whenever you have your bowel movement, you'll collect stool. And depending on which lab test lab company you go with. It could be a 1-day collection, a 2-day collection, sometimes even a 3-day collection. So you basically collect your stool in a little vial. You may have to mix a little solution with it, and then you ship it off. You store your stool for a little bit, and then you ship it back to the lab. So that is pretty much what a stool test is. And with that being said, once it gets back into the lab, they can interpret what you have going on in your gut. Do you have yeast? Do you have bacteria levels that are not good? Do you have fungus? Do you have inflammation? All of those things typically are revealed in the gut test.
Yeah. You may have to put your stool in the refrigerator.
That's right. That's right.
Mask it and hide it, or put it in a refrigerator that nobody uses. But once you have that information, I feel like the empowering part of functional medicine is that then you can do something about it.
Exactly. Yeah. Exactly. You can support it. You know what to do.
Yeah.
It's very enlightening to know, wow, I didn't know this was going on, and this is what I need to do. And so it's really a good starting place for any type of health issue is getting your gut checked, looking at your poop.
I think the most feedback that I've gotten from clients is when they cleaned up their gut is that they were happier. Like depression and anxiety went away. They had more energy. And the basic things like their bowel movements were better. They were.
It's life-changing. Life-changing.
Yeah.
I'm sorry.
That's okay.
I try to cut everything off.
Yeah. So the first thing that we look at is the gut, and that's a stool test. So what's another area that you would focus on with a new client?
So another thing that I like to look at is genetics. Well, let me before I go into genetics, we'll talk about micronutrients because that kind of ties in with the gut health. So micronutrients I really like because our bodies, it's basically vitamins and minerals in small amounts that our body needs. But when we have deficiencies in these micronutrients, it can actually cause a lot of issues that could be even life-threatening. And so by looking at micronutrients, you can support your body much more optimally, because maybe you're someone who's struggling with like hair loss, or maybe you're someone who is trying to get pregnant, or maybe you're just having a number of issues like anxiety, fatigue, the list goes on. The micronutrients can really give a lot of information on what your body is deficient in and what your body needs to be able to help support those issues. So I love micronutrients because it ties along with, if I'm eating the right foods and I'm getting the right and adequate amount of nutrients in my body, then, I won't have this deficiency of these micronutrients. So that's the second thing that I feel is very important to look at the microscopic level to see what deficiencies you might have nutrient-wise.
Right. And the way that ties into gut health is if we're not fully digesting our food for decreased hydrochloric acid or inadequate pancreatic enzymes, and the food is kind of passing through without getting fully broken down, then our body's not utilizing these nutrients. So that could be the reason why we have impaired micronutrients. Genetics, which you touched upon, could be another reason. So do you want to jump to genetics?
Yeah, let's talk about genetics. Everyone has different DNA. That's just how we're born. That's just what makes us up, is our DNA. And the beauty behind our DNA is that we have genes that we can turn on and turn off, which are affected by our environment. So what we eat, what nutrients we take in, how we're digesting foods can affect those specific genes. And so, if one is susceptible, for example, to cancer or some type of mental illness or diabetes or cardiovascular disease, what you eat what you starting at the gut. So starting at the gut, what you're eating, those nutrients that you are ingesting, the food that you're digesting, how is it affecting your genetics plays a huge role in what diseases you may be prone to later on in life. So it all ties in together, just starting at the gut, getting the right food, making sure you're digesting well, you're having the adequate amount of nutrients, and how that can turn on and turn off certain genes that may affect your health later on in life. So genetics is another huge factor to a why that can contribute to someone's health issues.
Right. So this week I interviewed my 9-year-old, almost 10-year-old son. And one of the questions I asked him was, how much of a role do you think genetics play in your health and your healthy aging? He was like, can't remember what he said, 80% or 90%. And that's what most people think. That's not a surprising answer from someone who's 9 or from someone who's 40. But the real answer is like 30%.
Wow.
So 70% of our health, the diseases that we get or don't get, is not determined by our genetics, is determined by our lifestyle and how we engage the environment around us day in and day out. So that one of the advantages of kind of knowing your genetic profile and how you metabolize nutrients, it can also help you determine how you have to supplement. So some people need more vitamin D than others because they're just, from a genetic standpoint, just need more. Some people are going to need methylated B vitamins because they have methylation issues. So knowing that ahead of time can help us determine the best supplements to support you genetically.
Yeah, absolutely. Yeah.
So we talked about gut health and micronutrients and genetics. So what other areas do you like to address that kind of helps you get to that why?
Yes. So hormones is another one. Hormones are chemical messengers that helps our body perform certain bodily functions. And when there's an imbalance in our hormones, it can cause issues with our blood pressure, our weight, our hair, our energy, and a number of other things. And so understanding what our hormones are doing will also give a lot of answers to some of the symptoms that someone might be experiencing. I had a patient about 6 or 7 months ago that I was working with, one of my coaching clients, and she was having heart palpitations for years. I mean, like 8 to 10 heart palpitations per day, very annoying. And she was on medication to support her thyroid. But until I did a full analysis of her thyroid and supported her diet and supplements, she was like, I can't believe it. I had 1 heart palpitation today after taking the supplements and diet changes for probably a week. She noticed a significant improvement in how she was feeling. And so I go back to say, when you really look at hormones, and this could be, thyroid's one of them, insulin's another hormone, looking at progesterone and estrogen, testosterone. I mean, there's lots of hormones that we have in our body, but looking at hormones specifically, getting a full picture of what our hormones are doing will really help one understand why they're having some of these symptoms. So I love hormones because it affects so many things, but again, they all connect together and tie back to these other things that we talked about today.
Right. I asked about how you get the gut health test, and that's stool, but I forgot to go back and mention. So for micronutrients, what kind of a test is that?
So it's a little finger prick that you take. You get the kit shipped to your house and you just do a little finger prick and you drop the blood on a little piece of paper, and that's how they can test your micronutrients. With
awesome. Easy. You don't have to go get a big blood draw.
No, you do not. With the hormone testing, so with thyroid, you always have to get a blood draw. That's the only way you can get that tested. But if we're looking at other hormones like progesterone, or estrogen, cortisol, melatonin, you can actually get that through urine and saliva, or a little swab in your mouth. So you can get that in your home as well. And it's super duper easy. You do the testing that way and you ship it off back to the lab. So there's no pinpricks or blood draws with that type of test.
Right. And how about the genetics?
Genetics is also a cotton swab. You just take the swab, you put it in alongside your cheek, and believe it or not, 2 weeks later, you'll have all this information on your DNA. Yeah.
And I've heard that one of the companies that we use is changing to a saliva test. So it's not even going to need the scraped inside of your cheek. So
okay.
I did have a client who just didn't scrape hard enough. And some people from a genetic standpoint don't break down as much tissue from that scrape. So they're using saliva now too. So yeah.
Wow.
Okay. So we've talked about 4 different areas. What's the 5th?
So the last thing that I'll mention is detoxification. This is how we get rid of toxins in our body. And so this can happen through exercise, sweating out or breathing out when we are exercising. So sweat and lungs or breathing is how we can excrete toxins. Urine is another way we can excrete toxins. So it's important to be drinking adequate amounts of water throughout the day so that your body can flush out toxins and that you can excrete it through urine. Same thing with having a bowel movement through our feces. That's how we can also excrete toxins. Very important for hormones as well, how we excrete those toxins and how our body gets rid of these hormones that we don't want to hold on to cause other issues is super important as we try to balance hormones. And then that's kind of the 4 main areas of detoxification. So what we breathe in and out, how we get it out through sweat, and then urine and feces. Those are the 4 main. Yeah.
And from a genetic standpoint, and that information that comes back from the little spit or the cheek swab, it gives information about your genetic detoxification. So from the liver detoxification, phase 1 and phase 2, I have a really fast phase 1. Some people have a really slow phase 2. Sometimes you can have a fast phase 1 and a slow phase 2. And we need to do things extra to support that if that is an issue. So cruciferous vegetables really help with that. Broccoli sprouts in particular. Make sure you are having a really good emptying bowel movement every day. So back to the gut issues to help you detoxify. Yeah,
absolutely.
Are there any tests that you use to look for detoxification? There's a couple that I like to use.
I haven't really used any. I think I'm doing my first mycotoxin test with a client. I haven't done that before. So this will be our first time doing it. But typically I kind of just educate on these lifestyle changes, like what can we do to optimize you drinking enough water, you having good bowel movements, you working out of sweat to excrete toxins. So I've pretty much done it that way, but I will say I do have my first mycotoxin coming up in a couple of weeks. So, and a mycotoxin is a test that looks for mold. Have you been exposed to mold that can cause a lot of issues? So I'm looking forward to looking at those results because it can affect a lot of things for many people when you have that type of toxin built up in your system.
Right. So it's very personalized. So I have had multiple clients with mold issues. It was personally something that I dealt with and I'm still dealing with from living in a house with mold. But it hadn't come up before, so you didn't have to do it before. So there you can look at heavy metal toxicity as another potential contributor to overall health. Do you talk about, so in addition to increasing our body's ability to detoxify, we can't avoid all toxins, but are there things that you recommend to minimize our toxins?
Yeah, absolutely. So one is what we're using in our home. So things like air fresheners, plugins, those are things that are encouraged to avoid. What is it? I say air fresheners, but sprays that, those are just not good.
Yeah.
In fact, if I go to someone's house who has a plug-in or who just used air freshener, I'm struggling. I just cannot take the smell. And it's because we don't use it in our home. I diffuse essential oils, and that's kind of how I keep my home smelling fresh. So that's one thing. Our beauty products, so shampoos, conditioners, body washes, perfumes, a lot of these things have toxins in them. And when you're putting them on your skin, when you're breathing them in, that can definitely affect your level of toxicity. So things that we're doing every day that you may not even realize you do. And we can't avoid everything 100% all the time, but to be really intentional on avoiding those types of things is very, very important to do. So think about what you're using in your house. What can you swap out for something healthier, something that doesn't have these types of toxins? So look at those products in your home, your soaps you're using. Can you switch out air fresheners to something like essential oils? Look at your dish soap, your laundry detergent.
Right.
There's lots of brands now that have, more clean products that are safe for the home. So that's really what I encourage one to start with, is just taking inventory in your home, seeing what you have, and looking at what you can change to make sure you're in a toxic-free home.
Right. It's empowering though, because we can control our own personal space.
Yeah.
We can minimize the toxicity in our own environment. I just listened to a podcast today about a husband and wife who were struggling maritally, and the functional medicine practitioner figured out through a brain scan that this guy, the husband, looked like he was a drug addict based on the picture of his brain. And he was not a drug addict, had never done drugs, didn't drink alcohol. They figured out it was from refinishing furniture. He worked in a furniture factory for the last 5 years, and it was the toxins in the solvents and the refinishers were destroying his brain. So be careful when you're doing home projects. Be aware of the chemicals that you're breathing in, that are getting on your skin. But again, we have control. So it is empowering once you know what to look for.
Yeah.
Well, thanks for going down that list with us. It kind of gives some insight on looking at the why and help people with healthy aging. So before we say goodnight, tell us about how you're helping women, how people could find you, what your focus is nowadays.
So I am a physical therapist, and I work with women and men who struggle with pelvic health issues, from, every time I laugh and cough and sneeze and exercise, I'm peeing on myself, to someone who might have pain with intercourse, or maybe you have fecal incontinence where you can't hold your stool, or constipation. I work with individuals with all those types of issues in their pelvic area. And then I also, with my functional medicine, because I'm in the women's health space, I work a lot with people that struggle with some type of hormonal imbalance. And so that's really my passion, being able to help individuals struggling with these issues better understand what's going on with their body by looking at hormones, and of course supporting gut and other things. But that's really my specialty, is the pelvic health and women's health area. And to find me, you can find me on Instagram at 360_health coach. That's 360_health coach. My website is 360hws.com, 360hws.com. That stands for 360 Health and Wellness Services. You can find me there. If you want to chat with me about any of those issues, you can book a free call and I'll be happy to chat with you.
Awesome. It's so good to talk with you and see you tonight. Dr. Danielle Bailey, it's been a pleasure. And I'll talk to you very, very soon.
All right. Thanks for having me.
Bye.
Bye.